talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button and turn on those notifications. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me, as always, is Sarah.
Hi.
Hello, Sarah.
Hello.
In the box, we got Travis. What's up, man?
Hello, how are you?
Good to see you. So today may be our happiest and simultaneously our most sad episode, because Sarah has very exciting news.
Oh yeah, I'm getting married. I'm engaged.
Sarah's getting married. Yeah. That's so awesome. Yay, Sarah. We're very happy for you.
Thank you.
I'm looking for my invitation to the wedding.
Yes.
But also sad, very, very sad, because today, I hate to even say it, it's Travis's last show. Oh. Travis. We are very, Travis, you tell me what you're gonna do, or is it secret? Should I not tell?
No, it's not a secret. So
yeah.
I'll be moving on to radio pastures.
Yeah.
I'll be going to a radio station, and I'll be working with a show called DD in the Morning full time.
Yeah, full time. Because you've been on it up to this point, just like part time, right?
Yeah, for sure.
Yeah.
But I've definitely enjoyed my time on Nip Talk, and now once I actually make the jump in the transition, I feel like I'll be able to professionally talk about all the plastic surgeries.
Of course, dude, you're like an expert, man. Facts. Like you are an expert now.
Facts. You train me up well.
Right. Go out into the world, Padawan.
Yeah.
You train me up well, for sure.
Well, dude, I'm very, very happy for you about the big promotion, but obviously, we're just about to hit the big time, man. It's like, I know, but you have to do this.
Yeah, for sure. But now, I feel like we already are big time, to be honest with you. We hit it a while ago.
When we get really, really big, I'm going to try to steal you back from the radio station.
I got you. I would happily come back.
All right.
Happily come back.
All right. Well, very good. Well, let's move on to our segments. Got some pretty good ones today. All right, you guys remember Tori Spelling? You guys may not remember her, do you? Yes. Sarah, you remember Tori?
Yeah.
Yeah, okay. Trey, Tori Spelling, ring a bell?
90210.
There you go. Yeah, very good. Yeah, Beverly Hills 90210. Her dad, Aaron Spelling, was big time producer. I didn't realize how many things that he actually produced. It was nuts. Like, The Love Boat and Dynasty and Beverly Hills 90210, Melrose Place, all that. Mm-hmm. But today we're doing a segment on Tori Spelling and her breast tissue, which is called Pectus Excavatum. And I'm going to explain all about that. So, Tori Spelling, no stranger to plastic surgery.
Yeah.
She's had some breast augmentation surgery, I think a few times, had a nose job. Of course, she's done the fillers and the Botox and all that stuff.
Yeah.
Lately, she's been really hitting the GLP-1s, like the Ozempic.
Yeah.
I actually, this doesn't have to do with her issue, but I threw a picture up in there. This is her at the beach. This is brand new. Like, I don't know, man. She's like really, really thin. Like really thin. I don't think she's always been that thin, right? Wasn't she?
No, she went through some phases for sure.
Yeah. I don't know. It's almost like I feel like she should have tapped the brakes on that Ozempic. But I mean, obviously it's her body. She can do whatever she wants.
Yeah.
It's just, she's very, very skinny.
Yeah.
So, so anyway, internet trolls have been griefing her, forever. Saying that she has a gaping hole between her breasts. How rude is that? That is so rude. I just do not like that
People say whatever they want behind a screen.
I know, it's horrible. I hate the internet trolls. I mean, they, picking on people, that's just terrible. All right, so, but this is due to a medical reason. It's not like a botched surgery or anything.
So she naturally had it before.
Correct. And so I'm going to show, there's a picture of it. I think that next one, Trey. Yeah, you can really see it there. It's kind of that divot right there at the top in between her breasts.
Yeah.
And she actually addressed it. Apparently she has her own podcast now.
Very cool.
Very cool, right? Love podcasts. And so she addressed it, and it was kind of funny. I actually clipped that, Trey. Can you roll that video of Tori talking about her?
She has a giant crevice between her tits.
I do. I get comments for years about fix that. That thing between your boobs. What is it? It's like a gaping hole. It's actually a bone thing. It's called a pectus excavatum. So anyway, I could get 50 million boob jobs, you guys, and it wouldn't take this away. Positive note, it makes for a hell of a party trick. Let me just tell you. I can pretty much hold up anything in between my boobs. Here, I'll actually demonstrate it right now. My sugar-free Red Bull. Oh, you know what? That's lame. I'm a podcast host. Who needs a stand? I mean,
Sexy.
yeah. Not many podcast hosts can do that. Take that, Joe Rogan.
I certainly can't do that.
No.
That's an impossibility for me. So, yeah, so she has Pectus Excavatum, which I don't think we've ever talked about on the show, have
No.
we? Yeah, it's probably, when I heard it, I was like, oh, we should have done this one before. Because it is a fairly common thing. So it's actually also known as sunken or funnel chest, and it's a congenital chest wall deformity whereby the ribs and the cartilage of the sternum start to curve inward.
I've seen dudes with it more so
Yes.
than girls.
And that's very interesting you say that. So I'm going to go ahead and jump ahead just a little bit before I show the first picture. It actually has a 4-to-1 male to female ratio.
Okay,
So that's why you've
that
seen
makes
dudes with
sense.
it. So I think there's a pic, Trey, this kind of little cartoon that shows this pectus. Yeah, there you go. So on the bottom, that's kind of normal. And then on the top, you see where there's this big indentation. And, you know, Pectus excavatum, it can be a lot of different varying levels as far as how severe it is. It has an incidence about 1 in 300 to 400 people. Again, it's much more common in males than females. It is due to abnormal cartilage growth. I do see it very commonly. You know, I do lots of breast exams, you know, more women than men, just being in the plastic surgery world. But I see it very, very commonly. And again, it can be varying as far as how severe it is. And so, you know, some people barely have it and they don't even know they have it. And then, you know, other people have these very severe cases. And the very mild cases are basically asymptomatic. You know, it's very common if somebody has a mild case that they're not going to know it. It doesn't cause any problems.
Yeah, because that image, it looks like it like offs.
The heart.
Yeah.
Yeah, so that
Does
would
that
be
like
a
cause
very
any issues with your
Oh,
heart?
absolutely. Yeah. So
Yeah.
if it's really, really severe, it can start to decrease cardiac output. And so you can have a wide range of symptoms, almost like you were, you know, in heart failure.
Ooh.
And so it can be, you know, potentially dangerous if it's severe. And so, you know, there are some treatments out there to correct it when it is symptomatic like that. There's a plastic surgery procedure called the NUS, N-U-S-S procedure, where you actually run a metal bar under the rib cage and under the sternum and basically try to force that indentation back out. And I've
Okay.
done a couple of them back when I was in training. I don't do those anymore because that's just not something that I want to dive into. But yeah, it's kind of a big operation. I mean, anytime you're messing with the chest wall, you know, you're close to the lungs, you're close to the heart, and it becomes a serious, you know, potentially
I'm
dangerous.
surprised they don't try to like fix that like as a child, like how they fix like
Sometimes
cleft
they do.
palate
Yeah,
and,
they
like, all
do
that kind of stuff.
sometimes. Like, yeah, when they're littler, yeah. Especially if it's symptomatic, you know, if it's severe. But then, you know, I mean, I think I remember doing on mostly kids, actually. I don't think I ever did one on adult. It's
Yeah.
mostly kids. I only think it did a couple. They're not common, you know. It's
Like once you fix it, like it's not gonna like do it again. Like even as like a kid.
I don't think it reverses. No. Yeah,
But like
once
as a
you get
kid,
fixed.
like if you're going through puberty or something like that, do you do it like before puberty?
No, I think it's a
or-
congenital problem. So
Okay.
it's you know, it develops in the womb.
Yeah.
You know, they're not sure exactly what causes it. They just know it's an abnormal growth of the
Yeah.
cartilage, and they don't know why. But I mean, you know, in nature, I mean, you see all types of, you know, variations and abnormalities. But again, most people have very mild cases, and then a lot of the women that when I point it out to them, they're like, "Oh, I never noticed that." But you know, when you are specifically talking about plastic surgery, it is good to note it because when the breasts are small, that little indentation may not be as noticeable. But then once you build up the breasts with, say, implants, then it oftentimes becomes more noticeable because there's like a huge cavern.
Yeah.
Kind of like how Tori had, where it was, you know, very noticeable that
I never
you know, that-
noticed it when she was younger though.
I didn't either, and so that maybe that was because we were seeing her pre-boob job. Also too, like if you're a little bit heavier, you're gonna have more fat tissue over it.
Yeah.
So it might be more noticeable now because she's like rail thin.
Yeah.
And before when she's a tiny bit heavier, had a little bit higher body fat percentage, it wasn't as noticeable. So
That makes sense.
also I think I had a picture of a really severe one, an external. Throw that up there. I kind of meant to, yeah. So that's a really severe one. That one's one that's likely going to potentially cause problems. I mean, it almost looks like there's just like a pothole in the chest.
Yeah.
So.
It almost looks like that's the back, and he's like sticking out his like scapular.
Right. Yeah. Totally.
That's crazy.
And so there is kind of another version of this where it's the opposite. So that's called Pectus Excavatum, which kind of makes sense. Excavation, kind of like a hole. But there's one called Pectus Carinum, which is the opposite, where the cartilage grows outward. It's also called pigeon chest, because you know how a pigeon has like a very prominent chest.
Yeah.
Again, much more common in men, but less common overall, like 1 in 1,500 versus the 1 in 300. And I see patients with that too, and I'll mention it. Anytime I see something on an exam around the breast when I'm thinking about doing surgery, I always bring it up to the patients because it can, give them a result that they may not have expected, right? Because they're looking at pictures online of people who have breast augmentation and they think, oh, I'm gonna have surgery, I'm gonna look just like that.
Yeah.
Not the case if they have one of these chest wall issues. But
Definitely.
yeah. So kind of back to Tori Spellum, not to like derail my own thing. Did you guys realize she's basically broke? Have you heard that?
I mean, I've heard that she's just like not doing well, but that's honestly because I don't think I've seen her in anything since she was like on reality TV.
Right. Well, apparently when her dad, who was worth $600 million, died, he left both of his kids each less than $1 million and gave all the money to his wife. And she like blew through that, and then she married McDermott. I don't think it's Dylan McDermott. I can't remember who exactly. It's something McDermott. I can't remember.
I think it's Dean.
Dean, that's it. There you go, Trey. Thank you, sir. Dean McDermott. Well, apparently they blew through a lot of money, and then they got into debt. And like, I was looking up, like it says on the internet that Tori Spelling's net worth is $150,000. Like that's just hard to believe. Now,
That's
eventually,
so weird.
huh?
That's weird.
Yeah, I think eventually she might get her mom's money. But yeah, that was really sad. And she was like living out of an RV. I mean, man, how crazy is that she fell that far? It's tragic.
Poor girl.
I know. All right, let me recap this one real quick, Trey. So today we were talking about Tori Spelling, who went on the record to talk about her chest wall deformity. She actually has Pectus Excavatum, which is an abnormality or a variation in the chest wall where it actually indents inward. And internet trolls were hounding her about it, and so she went on the record to talk about it and say that, hey, this is not related to me having plastic surgery. It's a congenital issue that I've had my whole life. And she's exactly right. Pectus excavatum is a issue that affects about 1 in 300 to 400 people. It is actually more prevalent in men than women by a factor of 4 to 1. But one of the reasons that hers might be more prominent is because, one, she has lost a lot of weight lately, so she didn't have enough fat tissue covering it. But also she has had breast augmentation, so that hole seems even deeper, like a bigger canyon. So yeah, I hate to see that people were griefing her about that. I mean, it makes me mad when, internet trolls grief anyone, but especially about things that you can't control. That's just her body. So, but yeah, Pectus excavatum, I see it all the time in my surgery practice, and I always talk to patients about it because when you have plastic surgery, if you have Pectus excavatum, it does kind of change things. So yeah, interesting stuff. Yep. Moving on to, I know Trey loves a good conspiracy theory segment, right, Trey? Or am I making that up?
No. You are 100%
Oh, yeah, 100% right. So this one's kind of a conspiracy theory. One of my friends who's a surgeon actually sent me a link talking about this. And so we're going to be talking today about cloud seeding and how it did not cause the Texas floods, which is some misinformation out there on the internet, which we're going to debunk. And as you guys probably know, the tragic floods in Texas earlier this month killed over 100 people. There's still almost 200 people missing. And of course, the misinformation brigade on the internet jumped on that and started to say that the flooding was due to human weather manipulation.
Yeah, I saw a bunch
Oh,
of
you
that.
did see that? So you guys saw that? Do you guys know about cloud seeding? Mm-hmm. You do?
Yeah.
Trey, do you know about cloud seeding?
Yeah, I've heard of it. I think I heard they do it in like Dubai.
Okay,
sometimes.
you guys know or knew, because I actually now I'm a semi-expert on cloud seeding, more than I did. I didn't realize that this was a thing, and when I heard people talking about it, I just assumed that they were like flat earthers or something, talking about things that weren't really a thing, all right? And so my friend sent it to me, and I was like, dude, why are you sending this to me? This is like not real. He's like, no, it is real. I'm like, it is? And so I had to deep dive on cloud seeding so that I could educate you, the general public, who probably already know about cloud seeding. And I'm like the last person on earth who didn't know what this was. But okay, so cloud seeding. All right. So it is a real thing. It's a weather modification technique designed to enhance precipitation, whether that be rain or snow. It works by targeting clouds that already have moisture and adds particles that helps water droplets form more efficiently. So what happens is they spread some particle into the clouds or above them, or they shoot it up. Most commonly, they use silver iodide, which I didn't know what they used. I didn't even know it was a real thing, much less how they do it. But silver iodide is the most widely used, which acts as a nucleus for moisture to condense and collect. And so I'm a visual guy, right? I like to see things, so I wanted to like educate you guys who probably already know exactly what's happening here, but I didn't. So I went and I made a video to try and show what happened. So
An AI
you got
video.
it is an AI video, and so I want you guys to rate my video. All right, play the video, Trey. Yeah, that's the best I could do. I tried for like half an hour. I tried.
That wasn't terrible.
It wasn't terrible,
I was like,
right?
wait, did the plane blow up?
No, I was like, okay, have a plane and then have flares come out, and then the first couple was like the plane exploding. I was like, no, the plane doesn't explode. I was like, it has stuff
And
coming
AI is
out.
like, are you sure?
Yeah, I was like, are you sure the plane doesn't explode? But that wasn't bad. So basically, that's what it does. I mean, that's one of the ways that they do it. The ways that they seed these clouds are commonly with airplanes, and that actually is one of the planes that does it. That was a NAOO, National Atmospheric and Oceanic Organization, maybe?
Couldn't tell you.
PC3 Orion. So the way that they spread the silver iodide is with flares. It's like some certain flare that they light, and then the particles come out. And those particles get into the cloud, and again, they act as a nucleus, and water wants to congregate on it. And so what it does is it encourages rain to fall, or if you are in a cold area, it encourages snow to fall. What is actually pretty interesting is this was developed by Bernard Vonnegut, who you may know is the brother of the famous writer Kurt Vonnegut. In fact, Kurt Vonnegut wrote a whole book about this technology after his brother invented it. Yeah, it's kind of crazy.
Working together.
So it's used to cause rain in drought areas and used to cause snow in mountain areas where they want snow for like skiing. So states where this is used: Colorado, California, Utah, Texas, Idaho, most common places. So does it work, right? I thought this was fake. And actually, I was almost correct, because for the last 80 years that they've been doing this, the only evidence that this worked was the experiments that Vonnegut did in a lab.
Okay.
They couldn't prove that it actually worked until about 8 years ago, when some researchers somewhere up north, Idaho, I think, actually, did prove with some research experiments that their cloud seeding actually caused an increase in rain. So as of even though it's been done for almost 100 years, it only in the last 8 years did they determine that this actually works. Any guesses to how?
In potatoes from Idaho?
Yeah, I guess. Any guess in how much increased precipitation that it causes?
Oh gosh, I couldn't even.
So 0 to 500%, I don't know. Let's throw a number out there.
75%.
That's a good guess. Trey, what do you think?
60%.
Trey's closer. It's 10%.
Oh.
So yeah, it's not like that. It's not that much. I mean, I guess if you're in a drought though, 10% could be
Something.
Yeah, it'd be something, right?
A sprinkle.
So, the big question is, why did the internet think that the Texas floods were caused by this? Well, there was a precipitating factor that started this misinformation rumor, because 3 days prior to those big floods over 4th of July weekend, there was cloud seeding done 150 miles away from the location that the floods happened. However, we know that this did not cause anything to do with the floods, because when they do cloud seeding, it's only effective right then. It works right then, or it doesn't work at all. It's not like the particles fly around and hang out in the atmosphere and come down 3 days later and cause rain.
Yeah,
and
it's not like they like spread and like take over the sky or something.
So, the internet jumped on that. And it's like all of these misinformation things where there's like the tiniest kernel of truth. Yes, they did some cloud seeding a few days before the floods. That actually is true, although it wasn't where it happened, but in the state.
Not even in the same county.
Not even close to the same county.
Yeah.
But everything else is basically false. So what caused the big floods? Well, there was actually a legitimate reason for the floods. It was Tropical Storm Barry in Mexico, combined with a stalled system over the Gulf, forced massive amounts of water into the atmosphere, which then traveled over Texas, and then the rain came down all at once, and those areas are prone to flash floods.
Yeah, I was seeing that Camp Mystic, that girls' camp, has been flooded.
Yeah,
many times before.
There is an interesting fact about cloud seeding. It was actually used in the Vietnam War. I didn't even know cloud seeding existed, so I sure as heck didn't know this until I read it. Used in the Vietnam War in Operation Popeye to extend the monsoon season to disrupt the Viet Cong forces.
You're like, maybe this will work.
I guess, I don't know.
Gotta do.
So I guess, the other question I'll ask you guys, is it ethical to change the weather? I mean,
if you can only do it by 10%.
I personally don't have a problem with it. I mean, I think there's the potential for unethical uses of it.
Yeah, like if you could create a tornado in any spot you wanted to.
Create a tornado.
That would be a little scary.
Or cause a drought to like force people to maybe buy your water. I mean, but I don't know. I feel like if they're using it to create snow for a ski resort or solve a drought problem, I personally don't have a problem with that.
Yeah.
I mean, that sounds like a legitimate use for it. So.
Yeah, I don't see a big deal.
Yeah. All right. We decided it's ethical. You guys can go ahead and continue cloud seeding. Yeah. Sarah and I decided. Trey was like, he's like, I'll let them decide. But yeah.
I'll leave it up to y'all.
Okay. All right. Very good. Okay. Let me recap this real quick, Trey. So today we were talking about cloud seeding, and we were debunking the misinformation on the internet saying that cloud seeding played a role in the tragic floods of Texas over the 4th of July. So cloud seeding is basically where a particle is put into a cloud, most commonly silver iodide, and they actually use a plane. And I have a really cool AI video I made if you want to go watch the full segment. That the plane drops the silver iodide into the cloud and acts as a nucleus where water will attach to it, and it increases the precipitation from that cloud. And so this has been around for 80 years, although it actually had only been proven to be effective in the lab, never in real life, up until about 8 years ago when some researchers did determine that it does increase precipitation, but only about 10%, which I guess if you're in a drought, 10% is better than nothing. So when the floods hit, misinformation trolls on the internet started saying that cloud seeding caused the floods. Well, there was cloud seeding done in Texas 3 days prior. However, it was 150 miles away, and cloud seeding only works right then. It doesn't like make rain happen days later. So we know for a fact that the floods were not due to cloud seeding. They were due, in fact, to a tropical storm, one over Mexico and one in the Gulf that super saturated the atmosphere with water, which then caused the flooding. So cloud seeding is a thing. Doesn't have a huge effect. We kind of talked about the ethics of, is changing the weather ethical? But you're going to have to tune in to see what we said. So, all right, moving on.
Real quick, too, we do have a couple comments on
we do.
Facebook.
Nice.
Kayla said there's no way they could have prepared for the rain, especially the camp area. I used to work out there at as a camp counselor.
Really?
And those are some hilly areas. She also said she is okay with cloud seeding only if it's in a place that is severely dry.
Okay.
Places that have like wildfires and stuff.
Yeah, I think that's reasonable. Yeah.
Yeah,
I think that the worst thing about this was just the severity of it. I heard the river raised 30 feet in like
Yeah, there
a few
was
hours.
There was like
That's insane.
I guess an infographic of like
Yeah.
an image of the river, like the
Yeah.
rivers and the lakes there, and how it like increased.
fast
It was
it
like
went.
it looked like a map, but it showed the water depth.
Yeah.
Like at the spread of the water there.
It's crazy stuff, man. Crazy.
Yeah. It's crazy.
All right, let's move on to our last segment. You can file this segment under Now I've Literally Seen Everything. This is a segment about a plastic surgeon who made a GoFundMe to try to save their practice. Have you guys seen this on the internet, Dr. Potter?
No, I've not seen this one.
I've seen, it's funny, I've seen this girl on the internet before. Like, I don't follow her, but like I watched one of her videos one time and I'll talk about it. And then, of course, the internet thinks, oh, he really wants to see more of these videos. So now I see all of them. So this is she's a legit plastic surgeon. She's here in Texas, she's in Austin. And earlier in the year, she gained some notoriety because she made a post on TikTok or Insta or one of those things because she was doing a case in the OR. And the insurance company wanted to do a peer-to-peer. So for those that don't know, peer-to-peer means that you're requesting some treatment for a patient. The insurance company wants more information. So they do a doc-to-doc. It's a doctor that works for the insurance company, talks to you. I used to do them literally all the time when I did a lot of wound care because it was always a challenge to get the wound care patients into the step-down facilities. So I was doing peer-to-peers like every week. And sometimes they'll give you options for when you can do it. And sometimes they say, look, we're going to call you from 7 to noon on Friday and you just got to be around or you miss it. And I've had them call when I've been in the OR before.
Oh.
And it is super annoying when they call and you're busy, but I mean, you just deal with it more or less. Well, anyway, so she got called in the OR and she was doing a surgery with another surgeon. And so she was able to just scrub out and talk to them. Well, she makes a post that saying, how dare you, I think it was United Healthcare, interrupt me in surgery so I can treat this patient. And of course, like hating on insurance companies is hot right now, right? Yeah. Everyone hates, they're like the new Nazis. Like no one is upset if you say that the insurance companies are bad, right?
Yeah.
Like everyone just hates the insurance companies. So this post like kind of blew up a little bit. And I saw it and I was like, okay, I mean, I've done that before and it's annoying, but.
I actually remember that video.
You do? Yeah.
So yeah, I remember her.
Yeah. Yeah. So I was just like, well, whatever. Anyway, and so there's more to it. Like, I have beef with surgeons like her that, so like her deal is she only does those free flaps. We've talked about them before, the DIEP flaps. When we talked about breast reconstruction, like that's her thing, and she does free flaps for breast reconstruction. And I've always been against that because no matter what any of those surgeons say, they do it for the money. Period, end of story, because people were getting rich and hospitals were getting rich doing these breast reconstructions as free flaps because it's...
What's a free flap?
So a free flap is like where I take tissue from here and I cut it completely free and I get the blood vessels and then I go to blood vessels up here and I sew the blood vessels together with a microscope and that keeps that tissue alive. That's a free flap. And we used them a lot for trauma. Like, so say somebody had a horrible leg injury where there's no tissue that you can move around to cover. You do a free flap because there's no other option, right? Yeah. So free flaps is like the ultimate highest level of reconstruction you can do. Well, these started coming out for breast reconstruction when I was in training, and we did some of them just because, every university center does what's new just to train people. Yeah. And I was like, these are junk, man. Like,
sounds really excessive just for
Thank you, Sarah. Job. Yes, it is excessive. Like the surgeries take like 8 hours. The cost is enormous, but the bills are enormous. Right?
Oh my gosh.
And so, when I was training, I did a second fellowship in breast after I did my plastic surgery, and I trained with Dennis Hammond, who you guys I'm sure don't know, but he's like legitimately famous, and not like TikTok famous. Like this guy's famous because he like writes the books on procedures. And I asked him about it, I was like, what do you think about these deeps? He's like, yeah, I think they're junk. I was like, sweet, I think they're junk too. And so when I started my own practice, I was like, yeah, I'm not gonna do these. I mean, certainly not gonna do them as a front line. I do tissue expanders, which take about 2 hours instead of 8, right? Much less invasive. There's risk with any reconstructions, but there's only risk here because there's no donor site. Yeah. I've taken care of so many DEEP patients who had horrible healing from their donor sites. They end up in my wound clinic, and it's just like problem after problem. But when when people are getting rich doing them, they want to always do them. In fact, I was doing reconstruction at one hospital, and they basically pushed me out because I wouldn't do them. And they brought in somebody that would do them because the hospitals get rich doing them. Anyway, so there are surgeons that do these flaps for every cancer patient. And, you know, I predict this. I've even said this on the show, like I think in our first year. I was like, eventually this is going to dry up.
Yeah.
Like insurance companies aren't stupid. I mean, they are stupid. They are stupid. But they're not total idiots, and they're going to figure out when something changes.
Yeah.
When suddenly they're paying 10 times as much for breast cancer treatments, they're going to figure that out. So what happened? They made it much harder to get these approved. And so hence, long story brought short, this doctor is constantly posting about, oh, the insurance company's trying to, you know, prevent me from doing this procedure on this patient. Well, yeah, they do that, and insurance companies are the worst, and they'll want to do peer-to-peer for things that are totally dumb. But I mean, part of the reason is that, you know,
There's
DFLAPs
people like her that exist.
Yeah, and also you have to think about like how this is affecting the healthcare costs.
Yeah.
Right? I mean, anyway, so like I've been following her, you know, because I actually enjoy anytime somebody's griefing insurance companies, and of course, you know, her posts are griefing insurance companies. So here's where it gets crazy. So she made a post recently. Again, I don't follow her, so it has to kind of filter through before I see it. And apparently she built her own surgery facility.
Okay.
With the goal of doing insurance cases there. Okay, now I know this is getting into things you're not familiar with. I actually am familiar with this because I've worked at many places that had their own private ORs. Because that's a really common thing for plastic surgeons to do, is to build their own OR, but they do cosmetic cases there.
Okay.
Because they don't have to deal with insurance. Patient pays for the facility fee, you pay for an anesthesiologist to come in, and you do a cosmetic case like a breast aug or whatever. I've been in multiple facilities, and I'm talking top-notch, like best of the best facilities that have tried to get insurance contracts. Insurance companies will not do it. They will not give a contract to an independent OR. They just won't. I've never seen it. I've never heard of anyone getting it. In fact, there was a girl that I know here in Dallas that was building an OR, and I was like, wait, why are you building an OR? You're not gonna be able to get insurance coverage. She's like, oh no, we're gonna be able to get it. 4 years later, OR is sitting empty, they cannot get contracts.
Oh dear.
Yeah, and so this girl, Dr. Potter, built her own OR.
Same situation.
Same situation, but get a load of this. She blamed the fact that she was calling out insurance companies.
Ooh.
She said the reason I'm not getting contracts is because I called out insurance companies for, you know, the bad things that they're doing, which is totally false.
Yeah.
I mean, insurance companies are dumb. They're not even smart enough to probably put two and two together that she's the one that was, you know, bad-mouthing them. They probably don't even care.
They're just following protocols.
Yeah, they're following protocol, right? And so what this doctor ended up doing is like she made a GoFundMe.
Oh my gosh.
Yeah, I was really shocked to see a plastic surgeon make a GoFundMe for basically a business decision that didn't work out. So I don't know. I mean, I personally am not going to donate to her because I feel like that this was kind of a mistake on her part. But I mean, she is fighting the insurance companies. So if you want to see, if you want to help out somebody that like is trying to stick it to the insurance companies,
She's talking trash.
yeah, you could like look up Elizabeth Potter. She has a GoFundMe, and actually she's gotten a lot of money. She's gotten like $400,000, I think. Yeah, it's a lot of money. It's crazy. I don't know who's giving it to her, like, because probably every single person that's donating money is like not as wealthy as she is.
Do you know the goal of what? Because
I think it was $500,000 maybe.
Oh, okay.
I think
What
it
is?
was
lot of
But
money.
what is the goal of the money? Like, what does she
Well,
intend
no.
on
Well,
doing?
because what's happened is allegedly she spent $5 million to build this facility, and she can't get insurance contracts.
So she just needs help paying bills.
I guess she needs help paying bills. Yeah, she said she had to like, I don't know, dip into her savings or something. I mean,
her goal amount is $500,000.
yeah, I guess that's a weird amount if you spent $5 million, but I don't understand the whole thing. I just want to know, like,
She's like, I need money to pay my staff and to pay rent on this.
yeah, isn't that weird? I thought it was weird. I actually wrote to her, but like on one of her posts, when she was talking about her facility, I was like, who told you that you could get insurance contracts here? And,
Yeah.
right? Because like that's not a thing, man. Like
That's not like the norm. That's like
no, it's not
Yeah.
the norm. You know, you have to be part of like a big facility like THR, Med City, you know, or whatever to get these contracts. You know, they just don't give them out to like an individual in their private facility. Like, it's just not done. I mean, it's not that she didn't get one. You know, she's calling out specifically United Healthcare. I think she's got 0. Like, there's all kinds of insurance companies out there. Like, no one's given to her because they just don't do it, which I think is wrong, honestly. And honestly, if she's able to put enough pressure on them that it opens the door for individuals to get insurance contracts in their facilities, I think that'd be fantastic. I don't think it's going to happen, but I just can't imagine that the insurance companies are going to suddenly change things. But I mean, who knows?
Yeah, I feel like she's just going the immature route.
I feel like
playing
she's
the victim.
Yeah, I feel like she's riding the anti-insurance, you know, wave right now. Which I mean, I don't like insurance companies either. I think they're terrible.
Yeah, she's got to spin it to make a
spin it to win it.
Yeah, that's what I feel like she's doing.
Yeah, I don't know. We'll see what happens. I mean, you know, I hate that, you know, she's in this bind, but I mean, anytime someone's building a private facility thinking they're getting an insurance contract,
you know the risk it's associated with owning a business, and so do I.
Yeah,
so it's like,
right. I mean, and $5 million is insane. That's an expensive facility. I mean, the building I bought, you know, 12,000 square feet. I mean, it wouldn't even close to that.
Yeah.
You know, I mean, ours are expensive though. There's a lot.
It feels like $5 million
bucks. Huh?
I said it feels like $5 million.
Thank you. I appreciate that. So, but anyway, we'll see what happens. So, all right. I guess that is all time. Trey, can you go on camera one last time, buddy?
He's like,
for
if
old
I
time's sake, man. Wait, I lost you. What did you say?
No, not if I have to. Not if I have to. I don't mind at all.
Yeah, dude, it's been good, man. Honestly, it's been a pleasure.
Absolutely. No,
Yeah, we gotta keep in touch. We gotta keep in touch.
100%.
Yeah.
I'm telling you, just because I'm leaving, don't mean my phone number don't work. So
Yeah.
please,
All right,
reach out
man.
to me. And I'll be tapping in.
Be
from
tuned
the
in?
audience. Yes.
Oh, dude, if you comment, I would be so excited. Trey said, like, Trey.
I will do.
All right, man.
It's been my pleasure working.
Yeah,
with
it's been a
both of you.
pleasure. I'm seriously, and we wish you the best. I
sure.
can't wait until you're like the most famous radio person in the world.
Please stop.
And I'll be like, dude, I used to work with that guy.
Yeah. Please stop. Please stop. You're done.
All right, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please leave us a comment and let us know what you want us to talk about on the next episode of Nip Talk with our brand new producer. Can't wait for that. We'll see you next week.
Bye.